Welcome, everybody, to another episode of Today and Tomorrow in Scottsdale with Don and with Kevin.
Hey, Don, how are you? Is it today or tomorrow?
Today and tomorrow? It's in between.
Right now, yeah.
It's,
the end of one day, getting ready to go on the next.
It's like, what's happening today and how will it affect tomorrow, and the heck with yesterday.
Yeah, absolutely.
We were done with yesterdays.
That's right. It's been busy lately. How about you?
We're today and tomorrow's.
That's right.
Never a dull moment. And one of the things we love about doing these podcasts is the fascinating people that we get to introduce and meet and talk to and introduce all of you listeners to. And we've got another one today for sure. Our guest is someone who's working at the intersection of science, innovation, and patient care. Angie Cooper, she's the Director of Research Business Development at the HonorHealth Research Institute, where she helps bring groundbreaking clinical research from concept to reality. With more than 20 years of experience spanning neuroscience, clinical trials, and military medicine, Angie is passionate about advancing discoveries that directly impact people's lives, especially for active duty service members and veterans. Angie, welcome. What a pleasure it is to have you here today.
Thank you both so much for having me. It's an honor.
We love talking to people who just come onto our show about their backgrounds, Kevin, right?
Yeah.
So tell us a little bit about your background, where you grew up, and how it is you got to where you are today.
Oh, I don't think the show's that long.
I was going to say, don't read your resume because we only got 30 minutes.
Yeah, we'll be an hour and a half.
I born and raised Californian. Did a lot of time ping-ponging across the country with my military husband over the years. I've been here in Scottsdale just shy of 11 years. It'll be 11 years in June. Clinical neuroscientist by education. I was graciously hired by HonorHealth, again, almost 11 years ago to help build their neuroscience research program. And since then, I've helped be a part of the development of other clinical research programs. And now I'm the Director of Research Business Development and my favorite hat, the Director of Trauma and Critical Care Research.
There's a couple titles I missed in the intro, didn't I? Yeah, we have to come back on top of those.
I love
for
it.
Sure, right? I love that. So your husband was in the Navy, is that right?
He was. He's a 22-year Navy retiree, retired in 2020 after our firstborn was born. Very grateful for his service, military physician, Purple Heart recipient, served in the war in Iraq in 2004, and is overall just a pretty incredible human being, and also supports HonorHealth Medicine as well.
That's fantastic. Yeah, you guys make a good team, huh?
Yeah, he's the best, but he keeps me honest.
So tell us about your job and what you do. I mean, titles all over the place, jobs that sound terribly complicated and important.
Yeah.
But so tell us about your job. What do you do?
I'd love to. HonorHealth Research Institute is incredible. HonorHealth as a healthcare system is incredible. I'm biased. I'm both a patient and a caregiver and an employee. Been there a long time. I always say I'll stay there as long as they'll have me. HonorHealth Research Institute specifically is focused on bringing the best care options, innovation to the front end of care. I think people oftentimes think about clinical research and clinical trials as last-ditch efforts. We have nowhere else to go. But one of the most amazing things about what this system has done is made it non-ancillary. It's frontline care. When you come through the door in any capacity, clinical trials are available to you in your therapeutic areas, whether it's oncology, neuroscience, critical care, cardiovascular, GI, bariatric. The sky is really the limit. And it's really an honor working with them because the providers, the physicians, the scientists, the nurses, it is Nurses Week, by the way, so hug a nurse if you have one in your life.
It's also Teacher Appreciation Week.
It is also Teacher
gotta hug
Appreciation
everybody.
Week.
Just hug
Hug everybody this week. Lots of teachers and mentors at HonorHealth as well. We're just so grateful that they bring these cutting-edge trials or bleeding-edge opportunities to our patient care populations. Yeah.
So if Kevin was going to walk into your office today, what would he see? What's there? How does your team work? How many people are there? What's a typical, probably not such a thing as a typical workday, but what's a workday look like?
It's a really great question, and I hope you never have to walk into our office. But if you do, we will take very good care of you. HonorHealth Research Institute is approximately 350 personnel combined of active clinical care personnel, administrative. We have a lot of back-of-the-house people who make such a huge difference but don't get to be in that patient care space. Of course, we have our physicians, our APs, our nurses, those frontline scientists that impact and drive the science and strategy of where we're going. Our executive leadership, Dr. Mark Slater, Chad Adams and Dr. Michael Gordon really drive and tell us where we are going as it aligns with where the world is going, where the science is going. And then I have opportunity to be able to steward said strategy to care for the individual patient that comes through the door. So if you're a trauma patient, you have a motor vehicle accident, you come in with a broken rib, how do we, in a clinical trial capacity, best care for those broken ribs in a new and novel capacity that can bring best care and improve your outcomes, decrease your pain, decrease your length of stay at the hospital, and how we care for your families as well. Caregivers are a really big part of clinical research, and that's a space that we really lean into as well.
Kevin, that's not the kind of clinical research that comes to mind when I think about clinical research. I think about academic institutions that have to take years to develop things. They got to go through FDA approvals and never make it to the patient's bed until like years later. But you're right there on the cutting edge of everything, right?
Yeah, that is our motto. We're trying to bring tomorrow's cures today, right? The whole point of innovation is not trying to follow the way we've always done things. A lot of these interventions that are investigational do take many, many years to bring to market and commercialize. So what can we be doing on that front end to bring these opportunities to patients today, whether that's in cancer, heart failure, GI, right?
So how does a community-based system like you have at HonorHealth contribute differently than the large academic medical centers? What's the difference between them?
I really appreciate you asking that, because I asked myself the same thing 11 years ago when I joined HonorHealth. I had been in a lot of different academic centers, site management organizations, military medicine, big federal research. And I said, how could we possibly be making a difference at a community hospital system? And there's a reason I've been here for 11 years. Because the care and compassion and the foresight of all of our providers and scientists to engage, support, and try and identify where needs are, where they are in our community, and not just the trends, but including the trends and how we meet the needs locally, and then expand beyond that. The drive to expand the body of literature, to inform, to educate, to steward patient care. The passion is just so incredible. And a community hospital system is just that. We are serving our community and beyond that in so many ways. And then just recently, we have become an academic or the clinical partner to ASU as an academic partner. So just building upon that momentum that we have had these last 20 years at HRI.
That's pretty cool. So what is the partnership with ASU? How will that benefit you guys?
It's a really great question. So ASU has recently expanded into the John Schufelt School of Medicine and Medical Engineering. They now have a medical school. So they are developing that and educating that next generation of future physicians and future researchers. So HonorHealth and HonorHealth Research Institute, as their clinical partners, is embedded in that process and training that next generation of researcher early on. It's not you're a doctor, now you do research. It's you're becoming a doctor. How do we educate you to become well-trained but seasoned and that passionate researcher long before they hit the bedside?
It's got to be passionate when you can take the clinical research right to the bedside.
Yeah, exactly.
That's amazing.
Okay, I have to ask a question. Let's back up just for a minute, because I'm an HonorHealth patient myself and have great experiences there.
Awesome.
I thought I knew what HonorHealth was, but you keep talking about it. You referred to it twice as a community hospital. What is a community hospital? How's it different from the other hospitals? Are there differences, or are you just calling it because it's in our community?
There are absolutely differences, and I think that is one of the stand-alones that HonorHealth contributes in our community, especially. Community hospital systems typically mean not-for-profit.
Okay.
And it means that we are all-comer open. So when I think about research specifically, there are lots of institutions, academic centers, healthcare systems, hospitals that absolutely have clinical trials, and I encourage people to look into those and seek opportunities for their care and their family's care. However, research and care at a community hospital system or not-for-profit is anybody that comes to that door is going to get care, and they are going to get the best care, and they are going to get all care opportunities that we have available, inclusive but not limited to clinical trials. And that's a huge difference. We are a not-for-profit community healthcare system that is serving the greater Phoenix Valley.
Yeah, I think I knew that and had forgotten it. Okay, so
Makes sense.
typically at your core, you are a nonprofit.
We are absolutely a nonprofit.
Okay, as opposed to maybe Mayo is probably not.
I don't believe that they're a nonprofit. I don't
Yeah.
work for Mayo, but regardless, when it comes to healthcare, everybody is doing their best to treat patients in the valley.
Of course they are.
But not everybody is all comers.
Yeah, they probably have a board of directors, I'm sure.
I think they do. For sure they do. Absolutely. So when I think about research institute, I think I've done a lot of work in the past with TGen.
Okay.
And all the work that happens to, how does it work? TGen's obviously just research. They don't really have bedside, right? So the research they do, it gets applied through a different health system to the bedside. How does that whole process work?
We've done so much work with TGen in the past, and currently I'm glad you brought that up. When people think about research and clinical means human subjects research. We're taking care of the people, the bedside of things. But research has a pathway. We have preclinical, or that sort of translational pre-human subjects research space, which TGen really focuses on. They're able to do lab research. They're able to do that bench side of things, and then it translates over time into, hopefully, that human subject space. Actually, HonorHealth Research Institute in just the last 2 years opened up a translational science center under Dr. Sunil Sharma. So while we continue to partner with TGen, with whom Dr. Sunil Sharma worked for many years, we are now performing our own translational research. So we, as a healthcare system, really have that bench to bedside care continuum to offer our patients.
You've got the whole shoot match then.
We like to think so, but we are always open to suggestion, and we're always looking for new opportunities and strategies and ways to really help develop that care process for our patients.
Learn something every time we do one of these episodes, don't we?
Okay, talk about the neuroscience part of it, because when you gave the example of somebody coming in with had been in a car wreck and you said they had a rib injury, I was thinking you were going to say had head trauma. So is that the second hat you wear then?
It's a great question. I am biased. I'm a neuroscientist by education, and I got to help build Neuro, although I don't get to particularly invest my time in that program overall. Our neuroscience research program.
Oh, I see. Okay, that's why I'm getting confused.
Well, I do get to support trauma and critical care. So traumatic brain injury rides both lines. That there's that neuroscience piece, the brain, and that traumatic space.
stop
you're
confusing. Your
you're not wrong.
background is in neuroscience, but right now you refer to as HRI, right? So you work for the Research Institute. Okay, I got it.
Absolutely, yeah.
See, I keep asking these questions.
No,
it
it's
clears
cool.
up for me after a while.
But that's the cool thing about
comes
HRI
on.
is they're in so many different therapeutic areas. We have the opportunity to serve so many different patient populations. And like you said, Don, earlier, not in spaces that people typically think of. When you think clinical trials, people immediately think cancer, which is appropriate. We might think hearts. We might think children. But there are so many other opportunities, trials, care opportunities for other therapeutic areas.
Treating a rib injury.
Treating a rib injury,
Like
absolutely. A
you
rib
mentioned
fracture,
before.
right?
Yeah,
Yeah,
right.
absolutely. Traumatic brain injury, spinal cord injury. Might be neuro, might be trauma, but all very important.
Participated in a clinical trial?
Thank God I've been healthy and haven't had to.
Ask me.
Have you?
Gout.
Oh no!
Really?
You're telling the world that right now?
You know, we also do rheumatology research.
See, I'm an open book.
He's going to want to edit this after we get through this right now.
I'm an open book.
You are an open book. We're going to
I
save
think I
questions.
got the placebo, though.
We're going to interview you later on, man. But we're not going to concentrate on you right this moment.
Well, thank you for participating in a clinical trial. That's incredible.
Oh, I'm not even going to ask questions about that, Kevin. Angie, what kinds of research are happening right here in Arizona that people may not are happening right here in their own backyard?
It's a great question. I'll speak to HonorHealth specifically. Our primary programs or therapeutic areas, again, I've mentioned cardiovascular many times. That could be cardiothoracic surgery, general cardiology, heart failure, interventional, surgical. Oncology, the sky's the limit. Our cutaneous or skin cancer program is growing like gangbusters. In fact, we just hired a new investigator. Our pancreatic research program is world renowned. Other areas might include some of our blood cancers, lymphoma, things of that nature. Certainly neuroscience, sky's the limit there, stroke, our neurotrauma program, anywhere in neurology, everyone's heard of Alzheimer's, Parkinson's, muscular dystrophy. We also do research in GI and bariatric, so weight loss is very front of mind, I think, in a lot of areas right now, but gastrointestinal health is incredibly important. We have a lot of research going on there. And then our multi-specialty research division, which does things like rheumatology, which gout falls into,
Yay.
orthopedics, and some urology, and a few other areas.
So you began your career in military medicine. How has that shaped your approach to research? And what kind of unique healthcare challenges do active duty service members and veterans face that research can help?
It's also a really great question. Thank you for asking it, because I do still feel over these years that our military populations are underserved when it comes to healthcare, that there is so much opportunity to better treat and bring care opportunities to them. I started as a Department of Defense contractor, as a very green, very dumb 20-year-old kid who just wanted to do science and wanted to change the world at Naval Medical Center, San Diego. Was doing my education at UCSD, go Tritons. And it allowed me the opportunity to really identify very unique needs at that time in urologic oncology, eventually neurosurgery, behavioral health, big, right? PTSD, other behavioral health areas that have been brought to light even in just the last 20 years. And then nursing research. There is so much space and opportunity to be able to bring clinical research education, but also improve care for all of our incredibly deserving patients who have served or are currently serving in medicine, in the military.
It's reassuring to know, because the underserved population for folks who have just served their country like that, and then they come back and they have needs and they don't always get them met. So that's just heartwarming to know that you guys are really focused on that. Yeah, for sure. So how did you've been researching now for 20 years. What first pulled you into it? What was the spark that said, this is the career I want to take on?
Nobody wakes up as a child and says, I'm going to work in clinical research. There isn't a single person out there that says that, and if they do, they're lying.
Yeah.
I fell into it, and I think that's a common story with so many clinical researchers. My mom was a nurse for many years. My dad was a police officer. I knew I wanted to help people, but I didn't really know what that meant. And I stumbled into this incredible opportunity to contract with the Navy to do a study here, a study there. And then I fell in love. I fell in love with the military, literally and figuratively. It's where I met my husband.
Right.
I fell in love with the patients, and I fell in love with the medicine and the science. And so that really stewarded the trajectory of my life and how I knew I wanted to best serve the community that I was in then, and then the communities that I had the chance to fall into later on.
And how did you land in Phoenix? Was it HonorHealth offer your job, but you were here anyway, or how did that work?
HonorHealth, they did offer me the job. My husband got out of active duty. We knew for the first time in, years, we got to choose where we were able to live.
Right.
We wanted to go back home, but didn't necessarily want to go back to California. We had discovered and researched, shocking, there were a lot of spreadsheets involved, the cities we wanted to live in, the medicine, where we wanted to raise a family, and this opportunity, Donna Sells, who is now the COO of HonorHealth Osborne, right across the street, offered me a job, Mark Slater at HRI, to help build their neuroscience research program here at HonorHealth, and that was it. The rest was history. We stayed, and we'll never leave.
A lot of people say that. They come here, man, they just stay. Kevin, you did, I did. That's just the way it works, right?
I came down here to visit my mom one time and never left. I'm still here.
Yeah.
I just never unpacked. Hey, Angie, let me ask you this. 20 years in research. Talk about some advances, or I don't know if I want to use the word breakthrough or not, but tell me some of the things that you've seen have changed or you're proud of, or something that's kind of that was gee whiz moments, if you will.
I'll speak to two examples very quickly. One, on a personal front, what I've seen on the clinical research space is the advancement of mentorship and education and support of the administrative side of clinical research over the last 20 years. Historically, and appropriately, we've only been focused on the scientists or the physicians. Very, very important. They are the strategists. They are the ones stewarding the science. But there is so much that goes on in the background and so much that is needed to help advance all areas of medicine, and education and mentorship are so critical, especially in research. And to see that tide over the last 20 years, in my experience, has just been so neat to see. And then also to see that mindset embedded into healthcare, to see research in the forefront of healthcare and not just this ancillary thought of this last-ditch effort. And then the other piece, at HonorHealth Research Institute specifically, you were talking about your bench research, that bench to bedside concept of patient care. Our oncology program, when it was developed 20 years ago in HonorHealth Research Institute became to fruition 20 years ago, really had a heavy focus in pancreatic research and pancreatic cancer. If any of you are familiar with pancreatic cancer, there are some pretty devastating statistics related to that. And our healthcare system has, in their research, brought 3 novel drugs to market just via our own small little community hospital system research institute to help improve care, increase longevity, and support the lifetime of our pancreatic cancer patients. It's been incredible to see.
Amazing. So when you have a breakthrough like that, does that research then get shared with other health organizations?
Absolutely.
That's kind of the way the world works, right?
In fact, the development of those drugs changed what we call the NCCN, which is the National Cancer Care Network guidelines
Really?
for pancreatic care research. The scientists behind that, Dr. Urquit Borazanci, Dr. Michael Gordon, really brought that to fruition in the last decade. It's unbelievable to see the changes that have been made in a disease that is so historically the way we've always done things could be devastating. And now people are living longer. They're having a better quality of life. There's hope. There's hope.
God, Kevin, if I was still at the Business Journal, I'd be writing stories about these guys.
You'd be halfway through it right now.
It's like, so the things you're talking about that are big deals on a national sort of healthcare basis, are you getting attention? Or where's the attention coming from? Where's the accolades? They got to be coming from you.
There are two answers to that. We can never get enough attention for clinical research in science, right? Because only certain things are sexy. Only certain things sell. A broken rib in a clinical study isn't as cool as curing cancer, right?
It's true.
But we are absolutely getting attention. HonorHealth Research Institute has its own community outreach and communications division that spends a lot of time out in social media, the news, the networks, to bring attention to our patient stories first and foremost. They are the true advocates that can tell the story of what that research experience looks like. Of course, our clinicians, our scientists, our providers, and then the other people, our staff, our personnel, our nurses, again, Nursing Week, second shout out, that are actually carrying out these clinical research trials in our community.
I think you better tell your communications department about Kevin and his gout story.
I'm going to.
I was going to cut that out, but now you've mentioned it twice.
You can't cut it out.
Yeah. Well, Don asked you about where's the publicity coming from. You are on the Today Tomorrow and Scottsdale podcast at the Star Worldwide Network Studios.
That's right.
So Good Morning America probably be calling here in a minute now.
Any chance for sure. No, this is fascinating stuff. So looking ahead, we just talked a little bit about your background and where you got here, but looking ahead from a research standpoint, what innovations or trends in clinical research do you see coming in the next 5 to 10 years?
Boy, is that a loaded question.
Yeah.
So many things are changing, and they change so fast with the advent of new devices, technology. Everyone talks about AI. I prefer the term augmented AI because it's really augmented intelligence because it's augmenting the work that we are doing in medicine. There is so much coming on the forefront. I think particularly at HonorHealth Research Institute, you're going to see a big leap in behavioral health research, especially with our partnership at ASU. We have historically not had a broad opportunity there, and now you're going to see some big investments, some big growth at a lot of our campuses really focused in behavioral health. Continuing to grow oncology, cardiovascular neuroscience. We are expanding a postdoctoral research fellow, so we're going to be having new and innovative scientists, that fresh and new blood coming through to help keep us focused on getting our eye on the prize and where the future is, developing that next generation of scientific leader.
I wonder how you even predict that stuff. The world's moving so fast when it comes to this kind of business, right?
Amen.
Yeah. So, I mean, it's like asking a question, where are you going to be 5 to 10 years from now? Who knows? Where are you going to be 5 or 10 months from now, right?
Right.
And
Absolutely.
that's crazy stuff. So have you had an experience where you've been able to see your passion actually show up in a patient? And have you had a couple of those, and are those memorable moments for you?
Yeah, absolutely. I was fortunate enough to spend the first half of my career really on the clinical side, so really actually serving patients at the bedside in some capacity. So many interesting experiences. I think getting the opportunity to help build from scratch, originally an N of 1, our neuroscience research program, and seeing it build into a program that serves approximately 300 patients a year, has over 100 clinical trials, and dozens and dozens of different disease processes and disorders. That hits home every day. I have a few different patients. I particularly remember my very first patient at HonorHealth. He was a neurosurgery patient, spine device. His provider was Dr. Luis Tumialan, who is a neurosurgeon with Barrow Brain and Spine, but at HonorHealth. Was with him at the Navy, actually, in San Diego for many years. So another military physician for whom I'm very grateful. Treated this patient with an investigational device. And if it weren't for this device, that man may have not ever been able to pick up his grandkids. He had lost so much of his peripheral nerve activity. And he was. Not 6 months later, that man was picking up his grandchildren on the ground, playing with his grandchildren because of an investigational device in a clinical research trial. I will never forget him.
What is an investigational device?
When we think of clinical trials, we always think drugs, right?
Right.
Oh, there's a new drug on the market. Well, we're not just studying drugs. Right. We're studying new devices, new technology, new techniques, new procedures. How do we improve on the things that we're already doing? Maybe it's quality improvement. Maybe it's just changing. I always call it teaching an old dog new tricks too. Long ago, we studied aspirin for one purpose, but now we use it for other things, right? Back pain and now anticoagulation, right? We do a lot of device studies, surgical trials, drug trials. There's so much out there.
Hard to keep up with that stuff. If you think of, if you could create a new device to help somebody with a spine injury, to help them recover.
Absolutely.
That's amazing.
At some point, the lens on your glasses was a device that was studied in a clinical trial. Yeah. At some point, anybody here wearing a hearing aid or have any heart, oh my gosh, I can't even think of the word.
Pacemaker?
A pacemaker, right? That's an example of a device that we studied in clinical trials and are still developing new products to bring to market to care for patients. We're always building on that next level.
And you partner with other organizations in the Valley then? Is that sort of just a medical community kind of thing where everybody sort of talks to everybody about the stuff that they're developing?
Absolutely. So clinical trials kind of run two lines. There's that industry relationship where we're partnering locally, nationally, and internationally with different companies, entrepreneurs, scientists, developers of new drugs, concepts, techniques, tools. And then there's the investigator-initiated side, which I like to call the homegrown project, right? We have ideas. We have questions. What do we need to do to develop our own clinical trials, ask our own questions, perform the science, and then publish on the data, publish on our findings to bring that to the body of the literature to improve and move that needle of education and innovation.
Let me ask you this. I was joking earlier about the gout thing, which is true, but I was also an oncology patient at HonorHealth recently as well. Robot-assisted surgery, right? That's crazy.
Absolutely. Also,
I don't even know what that is. I still don't know what it is.
Well, it is a form of minimally invasive surgery, and it's easy to say minimally invasive when is surgery ever minimally invasive. But if you were to think of a surgery that was once open to laparoscopic, I think of laparoscopic as try tying your shoes with a pair of chopsticks.
Right, okay.
And then it developed into what we call robotic surgery, right? So now they have the technique of now you're holding the shoelaces, but now your wrists can move. Yeah. Your fingers can move. Your elbows can move. So it's no longer chopsticks.
Lots of different surgeries are like the surgery like that?
Absolutely. There were some major areas of surgery that really brought it to fruition. Some of the larger abdominal surgeries, urology being a larger one. But we're seeing it expanded across a lot of areas, general surgery, orthopedic, cardiovascular. The sky really is the limit. It's really finding the niche area where those less invasive or minimally invasive surgical opportunities are appropriate for patient care.
We're in good hands, Kevin.
Aren't we though?
We're in good hands, man.
Yeah. I mean, you think about the healthcare corridor that we have. I mean, we have HonorHealth, which we've been talking about, and we're such big fans of. We have Mayo here too.
Yeah, and all sorts of smaller sort of supply chain companies, whatever. Yeah. We've got a really robust healthcare industry here.
We do.
That HonorHealth obviously is right in the middle of.
I agree. But again, I'm biased. Yeah. I think HonorHealth does a very good job of serving the needs of the people of the greater Phoenix Valley. Yeah. We have recently expanded from 6 hospitals to 9 and are really not only expanding the footprint, but our care capabilities to so many more people across the valley. And again, inclusive but not limited to clinical trials.
It's an amazing story. I'm glad I'm a patient on HonorHealth too, man.
Yeah,
just
me
like
too.
You.
Right? Yeah. Brown and I are talking about maybe someday leaving the valley and getting a place somewhere else. She won't even talk about it because she goes, you have to be within 20 minutes of a trauma.
I know, right. And you want to do it on HonorHealth, right? Yeah.
She's right. I agree with that. I mean, it would be nice. I'd like to have a place on the mountains or something, but she will not even discuss it.
Access to helicopter ride down there on HonorHealth and sit up there in Pine Top, buddy.
I know.
Yeah. Angie, what a fascinating conversation. I think Kevin and I learned a lot. So will our listeners with what we talked about today. So you're doing amazing work. It's been a pleasure to have you on here, and just thanks for all that you do.
Well, thank you so much for having me. And as always, it's an honor to be able to highlight the work that we're doing at HonorHealth and HonorHealth Research Institute. Thank you both.
Amen to that. And thank you all for listening. We'll be back again soon with another episode of Today and Tomorrow in Scottsdale.